Professor Len Bowers. I work at the Institute of Psychiatry, and I was the principal investigator on the Conflict and Containment Programme grant that funded the sugar group. And sugar made a contribution to that. Sugar's been in operation now for the entire 5 years of the programme, and they've been making contributions specifically to Safewards periodically. And as I was thinking about making this presentation this morning, one of the things that was going through my mind that I never really remark upon when asked this question is what it's like to speak to sugar. And the fact is that it is always stimulating, exciting, and increases your enthusiasm for the research that you're conducting. And it's the group that generates that sense of excitement. It's not that they're always positive about the things that I go and talk to them about. Quite often they're quite critical of the things that I say or the research that we're proposing. But there's always an absolute 100% commitment to the importance of it amongst that group, and they're always 110% engaged with the discussion, and they always have lots to say, lots of challenges to make, so that you come out of the meetings buzzing a little bit. And that enthusiasm is not to be underestimated. You don't always get that. I often don't get that from sitting down and talking across with fellow academics at meetings about research ideas, for example. So you come out of those meetings recharged, and it also reaffirms, for me anyway, when I go there, the importance of what I'm doing, what it's really all about, what the commitment is about. It's about making life, the world, the experience, the things that happen to patients on ward, making all of those things better, improving them. And sugar grasps that. Obviously they grasp that, but they also share that with the researchers, and there's a great kind of common cause there. And I guess we're both affirming each other, and that's why it's such an energy promoting experience to talk about. So that's a big thing. It's like a big battery. It's like, you know, kind of jump starting yourself when you go there to the meetings, and that's fantastic. And to any of the group who are there listening to this video now, who say this, I give a big thank you to all of you for that, for your engagement in that process. They helped us with the ethics application for Safewards. Again, that seems really quite small and quite distant in time now, but that was a big thing. We had a lot of things to work through ethically about what we could do on acute psychiatric wards and how we would deal with the issues of consent, particularly from patients within the context of what is technically a cluster randomised controlled trial. Now that was one of the occasions on which there was a lot of different opinions in the room amongst the researchers and also amongst the members of Sugar about what ought to or what ought not to happen. But that meant that when we made our ethics application, we could cite the fact that we had consulted Sugar and that there were these diverse opinions in the room, and this was what we were proposing to do, and these were our ethical arguments for doing what we were going to do. And that meant when we finally attended the ethics committee meeting that we were in a much better place to make our proposals and to get our ethics approval through, which we did. And at the time that was a big hurdle, and we were by no means certain that we were going to get our proposals through in the form that they needed to go through in order for us to do the trial. So the ethics was an important thing. The selection of the interventions that we were going to use in the trial, we had a long list. We started off with about 300, I think, different potential interventions, eventually winnowed that down to 30, and Sugar was a major group that we went to periodically to discuss those interventions with and helped us decide which out of those 30 were going to go into the pilot study. And then out of those that came out of the pilot study, so we went from 30 to 16 in the pilot study, and then after the pilot study we went down to 10 for the full trial, and Sugar was involved at those two decision points about deciding which were in and which were out. Sugar had their very own distinctive point of view on which interventions were the best and which weren't, and we definitely took on board interventions on the basis of sugar recommendations. I can think of one or two that went into the pilot that would not have been there without a specific and enthusiastic recommendation for Safewards, for their inclusion in the Safewards trial. And sugar's advice trumped the advice that we received from the professional expert groups on those occasions. So they had a major input into which interventions went forward. They also had a big input into the refinement of those interventions. So we had basic ideas about what the interventions would be, but fleshing those ideas out into what would actually happen, and giving background information and thinking about, let me give you an example. One of the interventions was positive words, and this intervention was we required staff on the wards, when they were giving shift-to-shift handovers, to say something positive about each of the patients they handed over. Sounds like a simple idea. What sugar did was give us a huge long list of potential things that staff might want to notice, about positive things that staff might want to notice and draw attention of each other to. And that meant when we went out there with these interventions into the practice arena, we gave far more comprehensive advice to people about what they might do, and that advice was distinctively informed by the expert knowledge of sugar. That's just one example, and that occurred with several of the different interventions. So there you are. That's what sugar did for Safewards. They were enthusiastic and they kept us going and stimulated. They helped with the ethics application, they helped select the interventions and made a contribution to that decision, and they helped us refine those interventions and fill them out in an informed way from the patient and carer's perspective.